Park, Texas. I wanted to talk to you today a little about Botox and its uses in relaxing facial wrinkles. So this is Botox. It comes from Allergan, and we're going to be doing a live patient demonstration soon, but I wanted to first just give you some of the background. So Botox comes from Allergan. It's freeze-dried. We reconstitute it with some saline, and then we put it in small syringes with very tiny needles to inject. The point of Botox is that it is a purified protein that relaxes the muscles of facial expression. Now, remember, I used the word relax, not freeze. We're not trying to freeze your face. We're just trying to relax the muscles enough to stop the muscles from making the lines and wrinkles on your face. Botox takes 1 to 2 days to see some effect. It could take a week or 2 to see full effect. So after you get Botox and you don't see something for a few days, you have to give it a few weeks before you can come back. The other thing about Botox is it lasts 3 to 4 months, and it has to be repeated. The good thing is if you stay on top of your Botox injections, the muscles tend to stay in a weakened state, and you can actually start to space it out after that. So if you like Botox, and most patients do, it's important to do it regularly. The other thing to remember about Botox is that it's very safe. It has been around more than 10 years. They've just celebrated their 10-year anniversary, and it has a remarkable safety record. If it's done properly, it's almost without parallel in terms of safety. So I'm going to turn here to our little this little face I drew. I'm sorry if it's not the best, but so what we're going to try to show you here is, this is our face, of course. The orange is the muscles that we worry about with the Botox. So we're going to first talk here. Now the blue is the wrinkles. So one of the wrinkles people always come in with are the 11s. Those 2 11s right here, you see those? Those are due to these muscles called the corrugators. They're kind of diagonal muscles, and they pull your brow together, and they cause those vertical lines. All the wrinkles due to muscles of facial expression mostly form perpendicular to the muscles that are involved. So you can see as these muscles pull in this way, pull the brow in, they make those vertical lines. If you also, and this is a lot of men, if you get a horizontal crease here in the brow, there's a muscle called the procerus that pulls the middle of the brow down and forms that horizontal line. The other area we're going to look at is the forehead. The forehead muscles, these 2 big ones up here are the frontalis muscles. Those are the ones when you raise your eyebrows, lift up your brow, and cause those horizontal creases. So when we use Botox there, we'll put some small injections in those big muscles to relax those horizontal lines. And also, we can change the dynamics of the brow to actually raise it. So if you men have a flat brow like this, women want more of an arch brow. And by doing some Botox injections in the forehead, we can actually raise the brow up. The other area we do a lot of Botox in is the crow's feet. If you look around the eye, there's a circular muscle called the orbicularis oculi, and that's the muscle that closes the eye. It's commonly also used when you squint or when you smile. So these muscles that close the eye, the wrinkles form again perpendicular to them and form those crow's feet. So our Botox injections are aimed to relax those circular muscle around the eye, to relax those lines. So some of the other areas that we worry about wrinkles on the face include around the lips. Those vertical lines we get around the lips, also called lipstick lines. Those are formed by the orbicularis oris muscle, again another circular muscle around the mouth that causes those lines to be perpendicular to them. Again, we can use a little Botox, not to freeze that muscle. Of course, it's important for speaking, for eating, from drinking from a straw, but just to relax the tone, to relax those wrinkles. So other places to look at are those lines, we call them marionette lines, at the corners of the mouth. This is actually due to a muscle called the depressor anguli oris, which kind of pulls, when you show your bottom teeth like that, it pulls down the corners of your mouth, and that muscle, I'll show you right here, causes that groove at the corners of the mouth as we age. We can relax that muscle at the jaw to help not only help with that groove, but a lot of times the patients will come in with a mouth that's kind of downturned, and we can just by relaxing that at least make the smile neutral, or even sometimes a little higher than a downturn. That makes a big difference. There's a couple other places you can do Botox on the face. We can do it for bunny scrunch lines, and for if you get that dimpled chin, and there's a muscle there called the mentalis, we can relax that muscle. So now the other important thing to remember about Botox, that's where the role of fillers come in. So if after years and years of facial expression, and as we age, the skin loses its elasticity and suppleness, and those lines start to become permanent. So there's a couple of issues there, and Botox cannot cure all of it. Now, if the lines are due to facial expression, Botox is necessary because you must relax those muscles to get that line eventually wrinkle, or a line eventually relaxed. If the line is very deep, that's where fillers come in. Fillers are natural or synthetic substances like Juvederm, Radius, that we inject to plump up those lines. So if the line is very deep, it's been there a long time, you can do Botox to relax it so it won't get worse, and it will help it, but you may need some filler too. The other thing to remember is that if your skin has a lot of sun damage, a lot of loss of elasticity, and it's in bad shape, you must make an investment in restoring the integrity of your skin. Various ways to do that. We have laser treatments like dot therapy. An easy one is a topical treatment like Retin A. The retinoids actually get into your cells that make collagen, which is the building block of your skin, stimulate new collagen synthesis, and make your skin more elastic and thicker. So when you do, that's why when we're younger, we can make all these facial expressions, we don't get lines because our skin is in good shape. But as we get older, our skin does not bounce back as fast, and that's where those topical treatments and laser treatments come together. So if it's just a small wrinkle that's not too deep, you could probably get away with some Botox. If it is a very deep wrinkle, that's where you have to put some filler in there too. And then it's also to remember that we have to work on our overall skin integrity. So those are the basic facets of Botox injections in facial anatomy. A knowledge of facial anatomy is crucial to get the right results and to make it last a long time, but it's also to remember where the fillers and other treatments fill in. Now we'll do a small demonstration on a patient of some Botox injections. Lawrence Broder, owner of Beleza Medspa in Austin, Texas, and I'm here with Abby today, a patient. We're going to be doing a demonstration of some Botox injections. So first I just wanted to show you what Botox is. This is how Botox comes to us from Allergan, the maker of Botox. It's been around more than 10 years, injected millions of times, very safe. Allergan is the original maker of Botox, and it's the one and only Botox maker. There are other neurotoxins out there, but Botox is the original and the most trusted. Botox comes in it's actually a freeze-dried protein in a little jar, and we actually have to open the jar up, and then we reconstitute it with some saline. That's where we all hear about the dilution of Botox. All Botox has to be diluted because, as you can see, if you look in the bottle, there's nothing in there except freeze-dried protein. So what we do, and it's pretty standard in the industry, some people are different, we just put 2 cc's of saline into the Botox, and we shake it up. It's all sterile inside, and then that's the Botox suspended in the saline, and that's what we're going to inject. So All Botox has to be diluted. You can vary the dilution depending on the amount of spread you want. If it's very concentrated, it stays in one area. If you dilute it, it tends to spread a little. So that's kind of personal preference. So we have reconstituted the Botox with some saline, and then I've transferred it to these very small syringes. These syringes have 32 gauge needles. These are actually insulin syringes made for patients that have to inject themselves every day. So they're very comfortable. The needle is extremely small, and that's what I'm trying to tell you. It's a relatively painless procedure. So the first thing we're going to do for Abby is just look at her face, and we see Abby is very pretty, but you know, how old are you, Abby?
35.
35. So she has a little sun damage and a little facial expression. She's done Botox before. So we're going to have her frown. So she's got a little frown line, and we call that the 11s, those two little lines there. Raise your eyebrows. She's got some forehead lines, and then we're going to have her squint or smile. There she goes. And she's got some smile lines, little crow's feet around there, not too bad. And so those are the main things we'll be focusing on today. So first we'll just apply a little alcohol. You can relax your head back and put a little alcohol on her forehead and around her eyes. So we're going to be focusing basically on her upper forehead and around her eyes. So the way this works is the first thing we look at, we actually have the patient make the facial expression. So we'll have her frown a little, and we actually pinch the muscle body and we put a little injection of the Botox into it. There you go. Now, was that painful at all? If it's done right with some distracting pressure, patient really should not have much pain at all. I'm going to do it once more. Frown for me once more. There you go. Do one last injection on that. Good. Okay, so we've done her, this will relax the muscles causing her frown. Now we're going to have her raise her eyebrows up. And she's got some small forehead lines. We're just going to relax her forehead a little and do a little, just a small amount of Botox, what we call a little brow lift. Okay, and raise your eyebrows once more. There you go. Do a little here and a little here. We're going to concentrate around her smile lines. We're going to have her smile once more. Remember, the smile lines are caused due to the circular muscle, they're the one we close our eyes with, and the lines form perpendicular to that. So you can see them radiating out. She has them mostly on the lateral sides of her eyes, so that's where we're going to concentrate. We have to be very careful in this area. There's a lot of little blood vessels, and you hit one of those, very difficult to see them, but if you hit one of those, you could end up with a bruise or a black eye. So we're going to try to avoid that, of course. So I'm going to have her squint once more, and I see where her lines are, and I'm going to make sure I stay away from the eye and orbital rim, and just do a little injection of some Botox. Once more. There we go. Perfect. And I'm just going around those little lines and giving her some Botox. Perfect. Okay. So now I'm going to come to the other side, and I'm going to have her smile once more. Good. Good. And one more. Perfect. Okay. You can see you left with some little bumps after the Botox. There's nothing to do. These will be absorbed into the muscle and under the skin. There's no need to make facial expressions or to rub them. They will just naturally go away. But that's it for the Botox injections. You can see very quick, very painless. You know, you stay on your feet immediately.